This image is of a family enjoying snacks in their kitchen. Why do families need genetic screening? As discussed in Part A, some people have a genetic predisposition to aortic dissection, and this can therefore run in your family. If you have had a dissection at a relatively young age, typically less than age 60, or if you have had additional findings that may suggest a genetic syndrome, it is particularly important to find out if there are any genetic factors involved and whether any of your relatives may be affected. This is sometimes called genetic screening. Your hospital team or PCP can refer you for genetic counseling and consideration of genetic testing. You may need to travel. However, if there are no genetics clinics in your area, there are remote genetic counseling services available as well. During your consultation, experts in genetics will discuss your aortic dissection, take a family history, and if a genetic cause is suspected, arrange for screening. The plan may involve genetic testing and/or imaging, i.e., CT, MRI, or echocardiograms for you and/or other family members. For those without a known aneurysm or dissection, it is important to discuss the implications of a positive genetic test or abnormal imaging test, especially as it relates to life and disability insurance. Genetic testing needs careful thought and discussion as it can lead to significant discoveries about you and your family's health. It is a personal choice. Some people prefer to be tested to find out more about their risks and whether anything can be done about it. Others prefer not to be tested as they do not want to carry the psychological burden involved. If genetic testing is not pursued or is uninformative, there may still be a need for periodic imaging for potentially at risk family members. Genetics specialists include genetic counselors, clinical geneticists, and cardiologists with expertise in inherited cardiac conditions. The term geneticist is used below and can mean any of these individuals as appropriate to the stage of your assessment. Geneticists are all trained to work with families and will explain the pros and cons of testing to help you and your family decide on the choices available to you. They will always respect your decisions on the matter. Receiving genetic counseling does not obligate you to undergo genetic testing.